Hello to all my fellow friends. My name is Hilmi Hasdi from NBSA1A for subject ASM404, my persuasive speech. The title of my speech is Why Should We Stop Smoking? Okay, first, what happens when you smoke a cigarette? There are several compounds found in the tobacco and cigarette smoke. Acetaldehyd. This chemical is used in resin and glues. Acetaldehyd is believed to be a carcinogen. Acetone. This chemical is used in solvents. Acetone irritates the eyes, nose, and throat. Long-term exposure to acetone can damage the liver and kidneys. Acrolein. Commonly used in herbicide and polyester resins. Acrolein is also used in chemical warfare. Acrolein is a substance in tear gas. It is highly toxic and irritates the eyes and upper respiratory tract. According to information trusted by the World Health Organization (WHO), more than 7,000 exposure to used cigarette smoke occur anytime or anywhere you are. In Malaysia, in 2006, National Health and Mobility reported that 21.5% of Malaysian adults under the age of 18 have been exposed to SHS in any area within the last 7 days. So today, I want to inform you about why it is necessary for smokers to quit smoking. Chemicals are found in tobacco smoke. At least 69 are cancer altogether. In a sense, respectively, over its 2,500 is dangerous. Do you know what the effect of smoking are on all of us? Well, ladies and gentlemen, based on some studies stating that exposure to the public, according to studies, between 90 to 95% of these cancers are due to smoking. The carcinogens, tar, and nicotine content of cigarette smokes not only pose a risk to active smokers, but also pose a greater threat to persistent smokers, especially women. Smoking for some people is a symbol of macho or a symbol of a man's greatness. Yet, when asking every smoker, they will always advise others not to start smoking because they themselves know what the effect is on themselves and how hard it is for them to quit. What happens to the body when smoking? Among the effects of smoking on the lungs is lung cancer. However, it is a long-term effect of smoking. There are various other diseases that can occur as a result of smoking, and after getting this disease, your lung organs will not return to the original even if you have stopped smoking and sought treatment. Emphysema. This disease causes shortness of breath. The more you smoke, the higher your risk of getting the disease. Smoking causes damage to the air sacs, alveoli, that are important in the exchange of oxygen and carbon monoxide in the blood and lungs. Chronic bronchitis is a chronic obstructive pulmonary disease, COPD, such as emphysema. Although it falls into the same category as emphysema, chronic bronchitis is caused by an infection and is caused by smoking habits. Cigarettes weaken the immune system and make smokers more susceptible to lung infection. Heart and blood vessel. The heart is the foundation for the smooth functioning of our limbs. The heart works to pump blood and supply oxygen to other cells and organs. So heart health is important in keeping organs and cells functioning smoothly. Among the effects smoking on the heart and blood vessel can be narrow blood vessel, will cause blood vessel to narrow and indirectly block and reduce the smooth flow of blood. This affects the function of the heart in supplying oxygen to the heart cells themselves. A heart made of muscle requires a high supply of oxygen because the heart is constantly working to pump blood to the rest of the limbs. This condition can lead to a heart attack. Stroke. Among the effects of smoking is to increase blood pressure, weaken blood vessels, and cause blood vessels to clog. All of these effects can cause stroke, are known as a stroke. The brain. Among the effects of smoking is nicotine-induced addiction. Nicotine can make a person feel happy. Nicotine has properties such as the hormone dopamine, which plays a role in improving a person's mood. This effect increases the desire to smoke and leads to addiction. However, this feeling of happiness is just a falsehood because smokers are not aware of the ill effects that occur on the brain due to this addiction. Among the effects of smoking on brain function are decreased cognitive function. In general, this cognitive function plays a role in our ability to think, memory, and process information. This function will decrease with age. However, studies have shown that smoking causes this function to decline faster than non-smoker. Dementia. Dementia is a disease of loss of cognitive function. Symptoms such as memory loss, difficulty making judgment, emotional change, and change in character. More than half of dementia patients will develop Alzheimer's disease. As described above, smoking increases the risk of dementia. Digestive system. Beyond knowledge, smoking also causes various diseases of the digestive system, such as oral cancer, esophageal cancer, and pancreatic cancer. In fact, many do not know that gastric disease can be caused by smoking. Among other diseases caused by the effect of smoking are heartburn. The effect of smoking will cause weakness in the upper abdominal valve, known as the lower esophageal sphincter (LES). This causes the valve not to close. This will cause an acid disturbance in the lower esophagus and will cause chest pain such as burning. Peptic ulcer. Malaysians know the disease as gastric. Peptic ulcers are caused by lesions on the stomach wall and part of the small intestine that are caused by an increase in acid in the stomach. In general, our stomach does produce acid for the digestive process, but too much acid causes wounds on the small stomach wall. Among the causes of this increase in acid is due to H. pylori infection, and the risk for this infection is increased due to smoking. So my point is to message to all smokers, please love your body, because our body organ is only one and there is no replacement. This bad effect of smoking involves your friend and family or people around you also. Please love your family for a brighter future. So let's all quit smoking for the health of us all. So for the conclusion, quitting smoking has many benefits for you and the people around you. Some individuals can quit smoke without the help of tools, therapy or medication. To make it easier to quit, you may need to quit by lowering your smoking frequency slowly a few weeks before your target date. You may consider nicotine replacement therapy or not with nicotine. The benefit when you quit smoking is reduce the risk of premature death and can add as much as 10 years to life expectancy. Benefit the health of pregnant women and their fetus and babies. While quitting earlier in life, there are greater health benefits. Quitting smoking is beneficial to health at any age. Even people who have smoked for many years or have smoked heavily will benefit from quitting. Thank you. That's all.